One of the things I do want to review with you is what we're going to be talking about today. Soft signs of autism spectrum. You might have individuals in your office that's the furthest thing from your mind. What I'm hoping is that if you're able to identify some soft signs that you can kind of determine if there's further need to kind of go into that area or not, because there are some things with the trained eye that you can detect. You may not have had some formal training, but there are some soft signs as I believe professionals in the community should be able to recognize as a kind of a clue. I call them flags. I might tell a family, I have a lot of flags right now that I'm holding just from what you're sharing. And then when I meet the child, whoa, lots more. And sometimes the child is 19. So I'm like, who is their pediatrician? Or, like, how did they get so far into their life that they had nobody ever bring this up? I think that's our doing. Sometimes we hold back and we don't recognize, or sometimes we recognize the signs and we're not even sure how to bring them up. Oftentimes we're faced with resistance from a family where we're like, okay, well, we're not going to say anything. But that's not doing justice to the child or you as in a profession, right? You're representing your profession. So today I'm going to give you some tools on how to recognize the soft signs and what to do with them. What do you do when you have them in front of you? The other thing we're going to talk about are the core traits. So further than the soft signs, what are some actual DSM-4 designated traits that you do need to have there present to be able to thoroughly and accurately diagnose autism? How do we tell the difference between autism and other conditions? There are a lot of overlapping conditions and some that are just mimicking that are not autism. Tricky. There is a lot of formal training that's involved to be able to dissect those. Sometimes they're easier and clean cut and you don't need to really wrestle with those other conditions. And sometimes you just need to kind of pull them apart little by little. So we're going to talk a little bit about that as much as we can in the time that we have. Also, what are some of the assessments that are going to be helpful? If you are trained in diagnostic testing, then what assessments do you need to be using in order to do this? And then I'm hoping we're going to have a real nice discussion because, again, my expectation is that you all leave today with the skills and the tools, at least just a basic minimum of number of tools that you can take and start using right away. That's going to happen with discussion. Please don't be shy. Write your questions down, send them to the front. I'll have them here and we'll make sure we get a good discussion going by the end of our presentation. So let's talk about some of those soft signs. You might already be aware of all of these that I've listed. There may be some soft signs that I haven't listed that you might want to say, hey, what about this? Because this isn't all-encompassing. This is just an overview. Some of the soft signs you're going to see or notice very often, there was a speech impairment. So sometimes in the beginning of their life, no matter if they are a summa cum laude graduate, when they were 2 years old, 3 years old, or even 4 years old, they didn't talk. Their speech was very limited. And then all of a sudden, boom, here comes the speech, right? Sometimes you'll see some early signs of echolalia. Everyone have heard of echolalia, what that is? So you might not see it very prevalent where they're repeating the words you're using, but maybe just once or twice in a conversation where you are picking up some, I call them whispering echolalia. It's present, it's not real pervasive, but it is present because a typical developing child is not going to have echolalia at any level. There's a difference between repeating what someone said and needing to repeat what someone said, right? So if I say, what is your favorite dinner? And they say, oh, my favorite dinner is pizza, that's not echolalia. But if every time I ask a question, they go back to talking about my favorite dinner, my favorite dinner, my favorite dinner, and they can't get off that, you're going to notice there's something a little strange about this child who wants to keep talking about his dinner. Those kinds of things. Sometimes they might even use a different type of tone of speech. Their language may be flat. They may not have some fluctuations in their conversation. We know a lot about children on the spectrum or even adults who will monologue, right? There's not this reciprocated conversation going back and forth. It's more like, let me tell you something and you just sit there and listen. That kind of language is also a clue for me. Occupational impairments, there are generally speaking some difficulties with some gross motor skills, whether they're I'm not athletic, or I can't catch a ball, or I can't balance on a bike, I'm 19, I've never ridden a bike, those kinds of things. But then there are some athletes who are really gifted who are on the spectrum. So all of these are not little checklists, they're just clues, right? So sensory issues, highly, highly debatable, big topic for professionals about whether or not sensory disintegration or sensory integration, depending on how you look at it, which perspective you're coming from, is or is not separate from autism spectrum. We're noticing that individuals on the spectrum pretty much have a commonality of difficulties with some sensory issues, but not everybody who has sensory issues is on the spectrum, right? So parents, when they know their children have sensory issues, will sometimes not want to tell somebody because they're fearful that you're going to say their child's on the spectrum. And they'll ask you, do you think every child that has sensory issues is on the spectrum, before they start to tell you that their child is doing this, you know, at the track meet and things like that. So right away, it depends on which perspective you are on. My perspective is no, they are separate. I have seen many children that have sensory issues and adults that do not fall on the spectrum, and I have seen the opposite of that. So I don't believe that everybody that has a sensory issue is on the spectrum, but I do believe that people that are on the spectrum have at some point in their life, maybe they were younger, they don't do that anymore, but when they were little, now they're 30, but when they were 3, they used to do certain things that they don't do anymore. Remember, your DSM-5 says any history, current or previous history at any point in their life. So don't let the statement of he doesn't do that anymore rule that out. Because right now, as our DSM-5 stands, it's any history of that, okay? And those sensory issues, again, those are just 4. There are so many other types of senses that we have. If we get into fancy words like vestibular and all that kind of stuff, I mean, there's more complex than just those that I've listed. Social difficulties, that's another controversial one, because you can see some individuals will struggle socially, you know, almost to a crippling effect of not being able to even communicate with others. And some are very social. They do great. And those are the children and the adults who get told they're not on the spectrum because they do okay socially. You have to dissect, and we're going to look at that slide further. What is going to determine a social difficulty? Is it driven by anxiety? Is it social anxiety? Is it pragmatic, you know, language? What is it? So there are different things that overlap and can confuse. The blunt affect, that's probably a cue, but it's not necessarily, doesn't have to be a trait. It's a soft sign. The mood disorders, I kind of say it like peanut butter and jelly. When I see somebody on the spectrum, there's like a mood disruption of some kind. Sometimes it's anxiety, sometimes it's depression, sometimes it's I don't have either one, I'm fine. You know, that's still dysregulation because they're not just kind of, you know, a little more flexible in the way they exhibit their emotions. Poor emotion regulation, how frustrated do they get, those kinds of things. This is just a little slide more about something that one of the pediatric occupational places gave us. 4 core areas. This is according to the DSM. You have your social section, your communication section, and I put in red the repetitive behaviors and ritualistic patterns because those have to be present to be constituted as an autism spectrum. So what do you do when everything else is present except for the red? And it's very obvious. And you're like, I know this person is on the spectrum because look at how they're, look at their skill set socially and communication-wise. It's perfect textbook. But what if they are lacking the repetitive or ritualistic behaviors? Does anybody have a clue as to what that could be? It's a brand new diagnosis, just came out with our latest edition. I hear y'all whispering. Yes. Yep.
What is it?
Social pragmatic communication disorder, and it's everything that encompasses and mimics and just really completely fits the bill for autism spectrum, but it's absent of the ritualistic and repetitive behaviors. I had a young lady not too long ago came in for testing, and here I go pulling all the flags, here's the consult, and I'm like, oh my gosh, I just know this young lady's gonna go study astrophysics. She's like early graduate, 15 years old, she's brilliant. And I'm thinking, oh, this little girl, she's got to be on the spectrum, right? We test her. She has no repetitive, no ritualistic, nothing. Yet she's highly socially anxious. What do you think her diagnosis was at the end of testing? Could we diagnose her with autism spectrum? She fit the bill like a T, except for the repetitive and ritualistic component. So that's when we look at the pragmatics. Very, very tricky. So when we're talking about social communication, we're talking about reciprocity. Are you enjoying interacting with somebody? Do you understand your role in interacting with someone? If you're sitting on the floor, if I'm dressed like this and I'm gonna have a child, I'll take my shoes off and walk around barefoot in my office with them. I sit on it, we have kind of a furry carpet, and I'll just sit there and put a pillow on my lap because I'm wearing a dress. But I'm genuinely enjoying my time with that kiddo, and I'm watching to see if they're taking some pleasure in having me pay attention to them. Some kids are just like, you could be here or you could be there, and I have really no care. Some want to interact, but they're not sure how to do that. I have a very kind of a biased part, my opinion, I should say, on the motivation of individuals that are on the spectrum, because we hear over and over and over, they don't really need friends, they don't really need, or they don't really want. I really disagree with that. I think that the way we're formed, I think naturally, I feel like it's just who we are as human beings and how we were created to connect. I think the skills are lacking. I think the information on what I can receive, what am I going to gain by interacting with you is lacking. That knowledge base, they're missing, and so it doesn't get reinforced. Think of it as this: you walk into a room, you don't know anybody, you're nervous, but as soon as someone's nice to you, that feeling that you get, that warm feeling of, oh, okay, this isn't gonna be so bad. They don't receive that, right? They're struggling to interact, and so it's reinforced that if I try to interact, I'm gonna get this weird look from that person like, oh my God, what's wrong with you? That reinforces for them to stay away, right? Because it hurts, it burns, it's like a fire. You touch it, you know not to touch it again. I don't believe that people on the spectrum don't want to interact and don't want to connect. I think they very much want to. They lack the skills and they don't know how, and it's being reinforced that it doesn't pay off. That's where we come in as professionals. We teach them those skills that don't come natural. Just a very big part of who that child is on the communication level.